My rheumatoid arthritis patients are stopping their methotrexate to try Ozempic, and some of them are paying for it. I've watched patients end up in the worst flare of their lives because of what they read online about these medications. But I've also had patients come in after 3 months on Ozempic, Mounjaro, Wegovy, one of those medications, telling me that their joints feel better than they have in a decade on the same RA medications they've always been on. And I thought that's interesting because nothing else had changed. The only variable was the Ozempic. And if you're someone with RA who has been hearing about these medications and wondering if they could help you, or even wondering if you should stop your RA medications to try this one, so what's the truth? I'm Dr. Neha, a rheumatologist, and that's exactly what we're going to get into today. I'm hearing versions of this story almost every week now. But first, before we go any further, why did this woman who had stable RA feel so much better on Ozempic? Stable just means low disease activity. It doesn't necessarily mean perfect, but it means you're functional, it's not holding you back from doing things. GLP-1 stands for glucagon-like peptide 1. And these drugs, semaglutide, which is the generic name behind Wegovy and Ozempic, and tirzepatide, which is the name behind Mounjaro and Zepbound, were originally developed for type 2 diabetes. And it works at a scale that we've honestly never seen before, with people losing 10, 20, 50 pounds, sometimes 25% of their body weight or more. But here's the part that most patients, and honestly many physicians, don't know yet. It's new in our world too. GLP-1 receptors aren't only in your gut and your pancreas. Researchers have specifically found them in the lining of your joints. And it's a big part of why what my patients are telling me makes a lot of sense. I want to break this down into 3 things that we're actually seeing in the research and separate it from what we know and what's emerging. The first one is the weight loss effect, and this one is real and significant. Fat tissue is not just a passive storage facility for fat. That fat is actually producing some of the same molecules that drive inflammation in rheumatoid arthritis. Molecules like IL-6 and TNF, and you may have heard of them because your rheumatologist might be saying, hey, let's get on a medication that is anti-IL-6 or anti-TNF. And imagine when we say fat is inflammatory, it's because fat is producing these molecules. So when someone loses a significant amount of weight on a GLP-1 medication, 2 things are happening at once. Your joints have less physical load on them, and that everybody can imagine makes sense. But the second part is that your body is less inflamed overall. And because these medications achieve weight loss at a scale that diet and exercise alone have a hard time reaching, the benefit to your joints is bigger than anything we've seen before from just weight loss. Because there is growing research that shows the GLP-1 drugs are reducing the inflammation in ways that go beyond weight loss. So studies have found reductions in the CRP, which is one of those markers of inflammation that your doctor might be ordering. And these came down even when people accounted for how much weight loss that somebody had. Because when you gain weight, your CRP or ESR markers, those markers of inflammation, can go up from just that. But scientists looked at that. And there's even newer real-world data from a large study that was presented at American College of Rheumatology in 2025. And it showed that RA patients that were on these medications, the semaglutides, had significantly lower rates of joint swelling, joint stiffness, and pain compared to similar patients who were not taking them. And that's not a lab finding, that's actual patient data. The third mechanism is the gut connection. This one is the most emerging, meaning we don't have as much data as the other ones, but the biology is still worth knowing about. We know that the gut and the immune system are interconnected. That much we've seen in different trials and different studies. We see an imbalanced gut bacterial environment, meaning you may have too much of one bacteria and less of another, or the wrong mix of bacteria in your gut. And this could be associated with rheumatoid arthritis, psoriatic arthritis, and other autoimmune conditions. Some researchers are actually believing that the GLP-1 medications may shift the bacterial balance in your gut in ways that could calm the immune system. Now let's talk about the question I get every week in clinic. Can I take Ozempic with my RA medications, or should I stop them? And if I take Ozempic or one of those medications, should I take it at the same time as my RA medication? And is it safe with methotrexate, which so many people are on? Some people are on leflunomide or hydroxychloroquine, Plaquenil. So those are the DMARD group of medications. So the direct answer is, in general, yes, you can take them together. Meaning you could take your RA regimen and you can take a GLP-1 medication. But the conversation of whether or not that these medications, the GLP-1s, are right for you is really the conversation you need to have with your rheumatologist, because they have to look at your kidney function, your GI history, if there has been any cancer history in the family, or any other health conditions. So there's no blanket drug interaction that happens, but you have to take the person in front of you and their background when you think about these medications and also adding them to your RA regimen. What I never want to happen is for someone to quietly stop their RA medications because they read a headline somewhere and want to try Ozempic, Mounjaro, Zepbound, something like that instead of taking their RA medications, because that's a decision that can lead to a flare and it's really hard to keep them in remission. So one of the ways we do that is having a good medication regimen, and certainly we can reduce medications. I have definitely done that before. I know there are some rheumatologists that don't prefer to do that, and there are some that do want to try. I tend to work with my patients on this, and it's not a black or white, but don't just stop your medications for RA suddenly if you are in remission or you're in subpar remission, because that can lead to permanent joint damage, and I want to be very clear about that, something we take very seriously. And if you know someone that could find this information helpful, please share it with them, because I want them to be able to weigh when and when not to add these drugs to their regimen without stopping something that might be working. Let me tell you what I'm actually observing in my own patients, because clinical experience matters alongside with published research. I have RA patients who have started a GLP-1 medication, some for weight loss, some because they have diabetes, others because they have very severe liver disease, and it can also help that. And then another group that has sleep apnea, it can help that also. And they come back telling me their joints feel meaningfully better. And this is not everyone. I would say though that this is the vast majority. Some of them have been able to cut back on anti-inflammatory medications, the pain medications like NSAIDs, even Tylenol. Some of them have inflammation markers that are finally improving. Forever, it seems, they have been up, even if patients have felt well. And then these medications help to bring them down. So there was something there that was inflamed in the body that we weren't able to actually pick up on in their joints. And they feel like they're finally moving in the right direction, especially when they see that some of these markers are coming down after being so stubbornly elevated for years and years. I know some of you are watching this hoping I'm going to say, yes, this is the thing that finally helps everything. And I understand that hope, because living with RA is exhausting, and the treatments, while they've improved, they're still imperfect. And the side effects are real. Here's my honest answer. If you're asking, will Ozempic control the underlying autoimmune process the way that methotrexate or biologic does? No. The GLP-1 medications do not stop your immune system from attacking your joints. They don't prevent that permanent joint damage that can happen from uncontrolled RA inflammation over time. That's not what these drugs do. And we don't have any evidence suggesting otherwise, at least not right now. But if you're asking, can they meaningfully reduce overall pain, inflammation, fatigue, and maybe improve quality of life, especially if weight is part of the picture? Possibly yes. And the science is increasingly pointing in that direction. So if you're asking, should I stop all my RA medications and just start Ozempic, Mounjaro, Zepbound, Wegovy? Please don't, not without talking to your rheumatologist, because that decision could cost you joint function that you cannot get back sometimes. GLP-1 medications are not a rheumatology treatment, but I do see them as being a part of a rheumatology regimen in the future. You may ask, why does my rheumatologist not prescribe these medications? And I would say, they probably don't prescribe them yet because it is so hard to get them. So right now, most rheumatologists are sticking to kind of their own biologic medications, but I think more and more of them are realizing that it is good in many cases to have GLP-1s on board if patients want to take them with their other physicians, or maybe some rheumatologists are prescribing them, then it is possibly favorable for them. And if you're seeing a headline that says Ozempic cures autoimmune disease, I want you to be skeptical. That's not where the evidence really is. But the real story is genuinely interesting. And I'd rather you have the accurate version from someone who treats this every day. I'm Dr. Neha with Plant Forward MD. And if you want to go deeper on RA treatment options, check out this video next.